Okay, my partner and I believe that the current drinking age, which is 21, should be lowered to 18. One of the many reasons it should be lowered is because it induces binge drinking. The Center for Science in the Public Interest states that the NIAA National Advisory Council says defining binge drinking concentration to 0.08 or above for a typical adult. This pattern corresponds to consuming 5 or more drinks male or 4 or more drinks female in about 2 hours. The CSPI Center for Science in the Public Interest states that in 2005, about 10.8 million persons ages 12 to 20 reported drinking alcohol in the past month. 7.2 million were binge drinkers and 2.3 million were heavy drinkers. The current drinking age from the CSPI, he also states that the 48% of college drinkers report that drinking to get drunk is an important reason for drinking. Almost 1 in 4 drink alcohol 10 more times a month, and 29% report being intoxicated 3 or more times per month. Studies have shown that limited alcohol consumption, a couple of glasses of red wine per week, can actually have positive health benefits. However, this message and those health benefits are lost in a binge drinking culture. Lowering the age limit would be an important step in changing drinking habits and would have long-term health benefits. Another reason is because of our freedom to choose. Legally, we accept that at 18, an individual is old enough to make rational choices about a whole host of things, from having sex to fighting for their country. We also allow 18-year-olds to harm themselves if they choose to by smoking and gambling. If 18-year-olds are thought rational enough to make those choices, there is no reason to deny them the right to choose whether to drink alcohol or not. This existing policy does not work. If a person under the age of 21 is caught with alcohol in their system, they will be charged for a misdemeanor. Calling it a minor in possession, or a MIP. However, why do we call it that if, as of the age of 18, we're no longer considered a minor? According to Jonathan Bailey, the chair of the Debate Selection Committee of Oxford Union Society, states that evidence from the U.S. which suggests increasing the alcohol age limit has no real impact on college students' alcohol intake. Studies show that most people have consumed alcohol before they reach their 18th birthday, so clearly the law does not work. A study at Arizona State University in the late 1980s, during the time Arizona increased its minimum age from 19 to 21, showed that only 6% of students reduced their alcohol intake. Perhaps more worryingly, 22% of students reported that they intended to take more soft drugs as they would be easier to hide in a college dorm than bottles of alcohol. When laws are ignored, it undermines the wider legal system in the eyes of the public. The legal system should reflect the reality of drinking patterns and have a lower minimum age. Who's keeping time? Okay, thank you. An interview with Dr. Ruth Ing, published in an article called "The Drinking Age Should Be Lowered." She says that drinking problems are reduced when young people learn at home from their parents how to drink in a moderate and responsible manner. Lowering the drinking age would help send the important message that drinking is, in itself, not evidence of maturity, that responsible consumption for those who choose to drink is evidence of maturity. Also, in the same interview, she states, "We need to reinforce the norm of moderation by making it clear that the abuse of alcohol is completely unacceptable by anyone. This would help stress that it is not drinking that is the problem, but rather drinking abusively." How we plan to change the current law is to have controlled environments and educational programs. The minimum drinking age of 21 appears to be not only ineffective but actually counterproductive. Although it was passed with the best of intentions, it has some of the worst of outcomes. In reaction to these problems, the president of Middlebury College created the organization Choose Responsibly to promote discussion and public debate on how best to reduce alcohol abuse. It has suggested a number of ideas. Choose Responsibly believes federal legislation should not penalize states that choose to participate in a pilot alcohol education program based on a minimum drinking age of 18. Thus, it is the group's belief that states that present a plan for educating and licensing young adults that can maintain low levels of facilities while lowering the drinking age ought to be granted a waiver of the 10% reduction penalty for a minimum of 5 years. States should create a mechanism to collect relevant data required to monitor the effects of the change in law. States should submit these statistics to Congress or its designate along with an analysis of the effects of the waiver from its inception, and may or may not request either an extension of the waiver. Individual states' proposals must include the guidelines for eligibility and suspension of licenses proposed in the model program. Choose Responsibility also proposes a new approach to alcohol education programs similar to driver's education in that it would be taught by a certified alcohol educator, trained specifically to cover the legal, ethical, health, and safety issues of the curriculum, and skilled in dealing with young adults. It consists of at least 40 hours of instruction, with the most time spent in the classroom setting, supplemented by sessions of community involvement. The alcohol education course curriculum would be a model for reality-based alcohol education, and it would provide accurate, truthful, and unbiased alcohol education. It would acknowledge the social reality of alcohol in American society, but it would advocate neither abstinence nor consumption. It would seek only to create a basis for responsible choices where alcohol is concerned. And that's it. Thank you.